Welcome to Pain Diaries. Because our nation is facing a national obesity crisis, I'm going to continuously address this topic on air. Being overweight and/or having obesity is a difficult disease to overcome. It's a chronic, relapsing, and remitting type disease, and is always something one unfortunately must live with. This is what drove me to pursue my board certification in the field of obesity medicine as a pain management doctor. I really try to figure out the root of the problem and see what I can do to help change lives for the better. Most recently, there's been a buzz about peptides and the weight loss drug Semaglutide. Maybe you've even seen the Hulu episode called The Skinny Shot. Taking a weight loss injection may sound very appealing, but you must make a fully informed decision before taking a step like that, as there are always pros and cons involved. So let's revisit. What is semaglutide? It's a medication used to treat type 2 diabetes and obesity, and it belongs to a class of drugs known as the GLP-1 receptor agonists. It works by stimulating the production of insulin and reducing the release of glucagon in the body. Semaglutide goes by brand names such as Ozempic, Rybelsus, and Wegovy. Semaglutide's been found to be effective in promoting weight loss in both diabetic and non-diabetic individuals. And a recent study that was published in the New England Journal of Medicine showed semaglutide led to an average weight loss of 15% among obese adults, which is significantly higher than other weight loss drugs currently on the market. Usually they're around 5% or so. Semaglutide works by reducing appetite, increasing feelings of fullness, and slowing down the rate at which food leaves the stomach. These effects can help people eat less and reduce their caloric intake, leading to weight loss over time. Medication's available as a once-weekly injection, and it can help reduce the appetite, increase feelings of fullness, and promote weight loss. So now I want to talk about some of the side effects of semaglutide that's been gaining popularity over the past few years. One of the injectable versions approved only for type 2 diabetes is called Ozempic. Ozempic's been proven to be highly effective in controlling blood sugar levels, but it can also cause a side effect known as Ozempic face. So what is Ozempic face? This is a term used to describe the appearance of facial fat loss, or lipoatrophy, or shrinking of the fat cells, in people who use Ozempic. This condition can cause visible changes in the face, such as sunken cheeks or eyes, or even thinning of the temples, and a more pronounced jawline. Why does Ozempic face happen? This usually happens because the medication causes fat loss in certain parts of the body, including the face. You can't just segregate one area of fat loss. This can be concerning for some people, especially who are already struggling with body image issues. So how do you fix Ozempic face? If you're experiencing this side effect, there's a few things you can do to help fix it. It's essential to speak to your doctor if you notice any changes in your appearance while using this drug. Your doctor may suggest switching to a different medication or adjusting the dosage. It's also important to maintain a healthy diet and exercise routine to help reduce the severity of Ozempic face. You need to eat a diet rich in healthy fats and proteins to help promote healthy fat distribution, while regular exercise can help build and tone facial muscles. It's important to maintain an adequate protein intake so muscle mass isn't lost. Finally, some cosmetic procedures such as dermal fillers or fat transfers can also help restore the lost volume in the face. It's crucial you consult with someone qualified in these procedures before undergoing any procedure, like any medication. Semaglutide can cause side effects. Other common side effects can include nausea, vomiting, diarrhea, abdominal pain, headache, constipation, dizziness, and even fatigue. Most of these side effects are very mild and will go away on their own. However, if you experience severe or persistent side effects, you should contact your doctor. Less common, but more severe side effects may include acute pancreatitis. Semaglutide's been associated with an increased risk of acute pancreatitis, a potentially life-threatening condition that causes inflammation of the pancreas. There's also been reports of worsening of diabetic retinopathy in some people using semaglutide. Diabetic retinopathy is a complication of diabetes that can cause vision loss and blindness. Gallbladder disease can also be a rare but serious side effect of semaglutide. Semaglutide may also affect kidney functions in some people. Labs are important to be monitored. Severe allergic reactions to semaglutide are possible, but rare. If you experience any of these serious side effects, you should seek medical attention immediately. So many of you will probably go on Google and search for a weight loss doctor near me, but What's next? I understand that losing weight is a difficult journey that requires patience, dedication, and a lot of hard work. I highly recommend that you find a medical supervised weight loss program that's designed to help you achieve your weight loss goals in a healthy and sustainable manner. If you want a weight loss program that's based on the latest research and evidence-based practices, and it's tailored to your specific needs and goals, I believe that everyone is unique, and therefore a personalized approach to weight loss is needed. You want a program that consists of 3 phases. First, the active weight loss phase, the transition phase, and then the maintenance phase. Each phase is designed to help you achieve your weight loss goals and maintain that weight loss long term. During the active weight loss phase, you should work closely with a team of medical professionals to develop a personalized weight loss plan. This may include a combination of a low-calorie diet, physical activity, and medication such as semaglutide, if appropriate. During this phase, the medical team must closely monitor your progress and adjust that plan as necessary to ensure you stay on track to meet your weight loss goals. Choose a team that will be providing support every step of the way to ensure you stay motivated and committed to your weight loss journey. Once you have achieved your weight loss goals, you'll then enter this transition phase. And this phase is designed to help transition from a weight loss mindset to a weight maintenance mindset. During this phase, you'll continue to work with your medical team to develop personalized plans that include healthy eating, physical activity, and other lifestyle changes that can help maintain your weight loss long term. The maintenance phase is the final phase of the weight loss program. During this phase, you'll continue to receive support and guidance from your team to ensure you maintain your weight loss long term. I understand that maintaining weight loss can be very challenging. That's why you need a team committed to providing ongoing support and guidance to you. With the right tools and support, anyone can achieve their weight loss goals and maintain a healthy weight long term. Semaglutide should only be used under the guidance of a healthcare professional in a plan that I have just described. Before you start semaglutide, make sure you talk to your doctor, and your doctor will perform a thorough medical evaluation to determine if this medication is right for you. There are other medications out there as well. Semaglutide is administered through a subcutaneous injection. Your doctor or healthcare provider will teach you how to properly administer this medication, and it's important to follow the instructions carefully to ensure that you are using semaglutide safely and effectively. Before using semaglutide, it is important to inform your healthcare provider of the following. If you're pregnant, planning to become pregnant, whether you're breastfeeding, have a history of pancreatitis, have a history of diabetic retinopathy, a history of medullary thyroid cancer or MEN type 2 syndrome, or if you have any allergies to medications or other substances. It's also important to follow your healthcare provider's instructions on how to use semaglutide properly and to report any side effects or changes in your condition. The dosage of semaglutide varies depending on the individual's condition and the response to treatment. Medications administered as an injection under the skin once a week. Usually we start at 0.25 milligrams once a week, and it can be increased incrementally up to 1 milligrams once a week if needed. The recommended dose should be taken once a week, on the same day, and at the same time each week. The medication should be injected subcutaneously in the abdomen, thigh, or upper arm, just under the skin. The injection site should be rotated to reduce the risk of skin reactions. Now, I've discussed how semaglutide helps with weight loss, as well as the potential side effects and how to take it safely, and the dosages recommended. It's worth noting that this drug does have FDA approval. On June 4th, 2021, the FDA approved Wegovy, a semaglutide injectable drug treatment for the chronic weight management issue, the first such drug to be approved since 2014. This new drug, which is called Wegovy, is a once-weekly injection as well that's helped show people lose weight and keep it off. Before approving Wegovy, the FDA conducted clinical trials to evaluate the drug's safety and efficacy. The trials involved over 4,500 participants who had obesity or were overweight, with at least one weight-related health condition, such as high blood pressure or type 2 diabetes. In the trials, participants were randomly assigned to receive either Wegovy or a placebo injection. Participants who received Wegovy lost an average of 15% of their body weight over 16 months, Those who received the placebo lost an average of 2.4% of their body weight over the same period. The FDA's approval of the new drug treatment for chronic weight management is a significant development in the fight against obesity. Clinical trials have shown that people can lose weight and keep it off, making it an effective tool for people struggling with weight management. While drugs such as Wegovy, also known as Semaglutide, are not magic, they're definitely considered a game changer in the world of weight loss. They can be a valuable addition to comprehensive weight management plans that include a healthy diet and regular exercise. If you're struggling with obesity or weight management, talk to your healthcare provider to see if a weight loss injection may be right for you. Semaglutide injected via the subcutaneous route is a medication used to treat type 2 diabetes and obesity. It's been shown to have several benefits, including improved blood sugar control, weight loss, and cardiovascular benefits. However, like any medication, it can cause side effects, and it's important to follow your healthcare provider's instructions and precautions. If you have any concerns or questions about semaglutide, please consult your healthcare provider. I'm Dr. Suzanne Manzi, and this is Pain Diaries. We'll be right back.